start with your hands wrapped around the knee, thumbs in the joint window. You're going to go up on the medial side, medial femoral condyle, medial femoral epicondyle, adductor tubercle. Come back down, lateral femoral condyle, lateral femoral epicondyle. Come back down to the joint window. Down on the tibia, medial tibial plateau, lateral tibial plateau. Come back up here, patella. Right above it, you see the groove. So you see an indentation right here. Come all the way down to the tibial tubercle. Come to the outside of the leg, you see the fibular head. In between tibial tubercle, fibular head, you see lateral tubercle. The other way you can do that is turn the foot in. On the lateral plateau, you can also see the lateral tubercle. Put the foot back in a neutral position. Come back to your joint window. From here, soft tissue, quad. Come all the way down, patella tendon, from the patella to the tibial tubercle. Superficial infrapatella bursa, pre-patella bursa. Come here to the crease in the knee. Right underneath you have pes anserine tendon, 45-degree angle. Draw a little circle, pes anserine bursa. Come to the outside, fibular head, 2 finger widths down. Run your fingers at a 45-degree angle. That's the common perineal nerve. It's where you can give someone a dead leg. You can feel the nerve popping over the fibula here on the outside. Come back to the joint window, lay your fingers flat in the joint window on the tibia, medial meniscus on the inside, lateral meniscus on the outside. Picture a triangle, and the triangle narrows as you come to the sides. MCL on the inside, LCL on the outside. So you can also run your fingers out from the tendon, and you'll feel that space get smaller. So MCL here, LCL here. Come to the back of the hamstring on the outside. You'll feel the tendon right here. This is called bicep femoris tendon. And then you have 2 tendons right here. The first one is semitendinosus. The second one is semimembranosus. All right, so you have semitendinosus, semimembranosus. The back of the knee, where the knee bends, is called the popliteal fossa. The popliteal artery runs through the fossa, so they're in the same spot. The very back of the knee, feel up in the center of the knee, have them pull their toes up and flex their calf muscle. You can feel the medial head of the gastrocnemius on the inside of the back, and then you feel the lateral head of the gastrocnemius right beside it. So on the back of the knee, the medial head sits here, lateral head sits here, but it's behind the knee. So you're on the back side. All right. Range of motion, you're going to set the goniometer up here on the outside of the knee. Line it up here to the hip, all the way down to the ankle. For flexion, you'll have them bring their heel to their butt as far as they can. Flexion goes to 135. Extension, you'll have them bring the foot all the way out, straighten the knee, and it should go to 0. Some people will hyperextend, so it can go past 0. Come to the end of the table. For your strength testing, for extension, he's going to kick his leg out. Hold your leg out, don't let me push it down. So this is extension. For flexion, he's going to bend his leg or bend his knee. Hold it there, don't let me pull it out. And I'm going to try to straighten his leg. That is for flexion. All right, lay back. Special test, lay back. Lachman's test is for the ACL. Lachman's test, you're going to stabilize the femur. You're going to wrap your hand around the tibia. So you're going to stabilize here, wrap here, and you're going to pull up on the tibia. Right here, let's say he has a really large leg and my hands don't wrap around. I'm going to brace up under his leg, stabilize here. This relaxes the hamstring. Then I'm going to be able to grab around the tibia. I'm going to pull forward. Then you have anterior, posterior drawer. Anterior drawer is ACL, posterior drawer is PCL. So you're going to put some resistance on the foot. You don't have to like plop your butt down on their foot, but just so it doesn't slide forward. Wrap your hands around. Anterior drawer, you're pulling forward. Posterior drawer, you're pushing. All right, so open the drawer, shut the drawer. Valgus stress test. Valgus stress test. Valgus has an L in it, lateral. So you're pushing from the outside. It means that you're opening up the inside. So it's a stress from the outside of the knee. Valgus at 0 means the leg is straight and I'm pushing on the knee. Valgus at 30 means I slightly bend the knee and I give the same force again. Varus force, I just change my hand position, move the leg out. I do it at 0 again and again at 30. Now if I have a really large leg, I'm going to use my weight as leverage. I'm going to use my armpit to hold, and I'm going to have both hands available to push on either side of the leg so I can control this leg even better. All right, and then the last test that you'll be responsible for is going to be McMurray's. McMurray's is a meniscus test. Grab above the patella, put your fingers in the joint window, put them all the way up into flexion. Flexion with external rotation, internal rotation, and push on the inside of the knee, push on the outside of the knee. Try and reproduce any popping or clicking they're having. And that's it.